There. No, we haven't. And we can all same thing because the people aren't always going to be the same.
I should bring my okay. Um, why did they want our photos?
It's because I have it charging from the computer.
Oh,
There
okay.
it is.
All right. I look like a crazy.
Oh,
person
outside
here.
looks beautiful.
It does. It does. I like having the curtains open. Actually, open that curtain over there. I'm so glad it didn't fall down.
No, you have to pull that way for it to go down. You know how many years it took me to figure that out?
It looks really pretty out there. Okay, you want to sit or you want to
I
stand?
can stand.
Okay. All right, so how do we say hi? Maybe you really pretty out there. Okay, you want to sit or you want to
I
stand?
can stand.
Okay. All right, so how do we say hi? Maybe you should sit here.
There it is.
Good morning, friends. Are my glasses crooked? No, it's
No, that's
fine.
just your head.
Okay. All right. Need to get.
I'm gonna order it. There it is.
I have a Michael Aron one at home, but
I'm not allowed nice things.
You know what? You're not. You're not. We can't have nice things. So, good morning. Welcome to Bridgeton, the home of
The heart of St. Louis.
the heart of God knows what.
The heart of
the
St.
heart of the
Louis.
Heartland, and the home of Express Scripts. Hate you, Express Scripts. But also the home of the Arthritis Center. Literally, I think I said on my glasses. I think I did.
Come on, Bubbles, you got this.
Okay. All right, maybe I should just not have glasses on, but then I can't read.
Oh.
Okay, so here we are today. Had some exciting things happen yesterday, and I really needed to have a win because I was getting a little bit down
That's
about.
what I was telling Dan. I was like, we both needed something to kind of push us in the butts because it was getting very...
2 nights ago, when Dr. Beck and I were out to dinner with our friend and his girlfriend. They're also healthcare professionals. She's a physician and he's a dentist. And she's like, I'm ready to retire. She's 54 years old. She's an infectious disease physician. And she's like, this sucks so much. And her boyfriend is a dentist and a good friend of ours. And he's actually retiring December 31st. So he's a little bit older. He's Dr. Beck's age. But nonetheless, I went from 2 nights ago kind of being like, God,
I'm ready to
healthcare.
retire.
I literally said that to him, and Dr. Beck's like, no, not yet. So anyway, so that was, I went from kind of a little bit of boo-hooing.
Yes, it's getting
2
way
days
out
ago.
of hand. I had a nurse leave, and I am lost now. Mm-hmm. Oh, I'm sorry, Tracy.
So anyway, that was 2 nights ago that I was boo-hooing about healthcare sucks. I can't handle it, although I can. And then last night at 4:30?
Yeah.
My friend called and he's like, hey, this is da-da-da, this guy wants to talk to you. And this guy that wants to talk to me is my business crush. Hi, Wendell Potter. Love you. Anyway, so I'm going to email him this morning. And
who is Wendell?
Wendell Potter is a 72-year-old man who I have a business crush on. You can Google him, Wendell Potter.
He's like the OG of this whole disruptor thing, right?
He has been disrupting since 2006. How old were you in 2006?
I was in...
Okay, well, we're not going to... The math isn't mathing.
Fourth grade.
Fourth grade. Okay. All right. There it is. I, of course, was a little bit older. But
she already had kids.
Yeah. Well, my kids were born in 95 and 96.
Hi, Julie. Jay Olson says.
Hello. So, anyway, Wendell Potter is a whistleblower who used to work at Cigna, and he quit after... because he couldn't mentally, morally do this anymore, of make up shit and spin it. He was like a spin doctor, or he likes to call it, he's a former chief propaganda officer for Cigna. So right off the bat, I have a disdain for Cigna, and so
I was
Wendell...
a little mad at him.
Well, why would you be mad at Wendell?
whenever I emailed him about our letter we got.
Oh, our nasty gram from Cigna. It's okay. Now, so we flew out to Milwaukee to go to a conference that Wendell was speaking at, and had a great time at the conference. As soon as he got off the stage, I'm like, get your shit. And she and I ran up there, and I said, Wendell, we want a picture. And he stood in the middle, and we were both fangirling. And I'm actually too old to fangirl. I'm 59 years old. So
I'm
that's
too young to fangirl over a 72-year-old.
No, you're too old to fangirl too. Fangirl is like 16-year-olds, isn't it?
Yeah, Backstreet Boys, Britney Spears.
Okay. So I didn't even know I was fangirling, but now I know because I'm surrounded by all these young women that know how to fangirl and know the lingo. So anyway, super excited. I think
I have his assistant's phone number. That's as far as I got.
but that's okay. I gave her the project like over a year ago. I said, you get me with him. And we found this conference. This was a year ago we flew out to Wisconsin, right? Yeah.
Oh my gosh, the emails that you did.
Yeah. I said, this is your project. And guess what? She freaking came through. Okay. We got the picture. And now advocacy disruption 101, we are way ahead of the power curve, and I am gonna hopefully have a meeting, like a legit meeting with him, not like
Hopefully he'll be on our
fangirl meeting.
podcast.
God, wouldn't that be the best?
But like my face during it would just be like.
I know you'd be giddy. I would actually like to interview him myself. However, I will allow you to ask
I
the
just
questions
get one
because
question.
no, you can have more questions because I ask questions for someone that's like my age, and everyone's patient. So people that are your age are patients, and they're dealing with these chronic diagnoses for the first time, and they're like, what is my body turning on me?
And there's so many people my age that are getting chronic diseases. Like just from high school, the people that I see come into our office, I'm like, oh my gosh, what's up?
Right. So
weren't we just in high school together? And you have a chronic disease.
Right. And so here's the common ground we have with Wendell Potter. We both disdain Cigna. That's huge. Everyone is a patient. He is a whistleblower and a disruptor. I love all of that stuff because without advocacy, these patients don't get treated. And I had a patient in here this morning. Her name is Dari. And she called me over when she was getting her infusion. She was patient number 2 that I advocated for a number of years ago. I think it was like in 2019. And she said, do you know that I couldn't walk upstairs and I have my children and my grandchildren? I couldn't be a part of that. And now I'm riding bikes with my husband. I have 5 grandchildren. I am able to live my life with this chronic, scary disease. And it's because of the work we do here. Had it not been for us throwing down in the advocacy space, that poor lady would probably have been on disability. Maybe been in a pine box.
Well, you give people hope.
We sell hope here. And this is what we do every day. We deal with scary stuff, and
We cry with patients. We
we
laugh
laugh,
with patients.
and sometimes we
snack.
we always snack. But that's like the real message here is rheumatology offices, we sell hope. And we have a whole lot of tools in our toolbox. Our clinicians have all sorts of treatments available. And if we can just get you on the right one for you and not the one size fits all that your crappy insurance company or your crappy or even, can you have even crappier PBM wants to be in charge of, then we can get you healed. I was actually talking to Dr. Bach last night, and he said, what do you think about once we get a chronic patient in here, we get them diagnosed, why don't we send an email or a note to their employer and say, listen, if you want me to care for this patient as they should be cared for, why don't you give me a pass to not step through the formulary you picked with your insurance agent that most likely was chosen by how much your insurance agent and your insurance company and PBM will make. Because it is so many of these self-funded employers have chosen some low cost plan, which
Or
is
they have
fine.
multiple.
Oh, yeah, and then what the reality is, when we get a chronic patient in here and we have diagnosed them and get them on what they need to be on, as opposed to the one size fits all, why would we want to waste time and step through all of these more expensive drugs that the insurance company wants to? Now, we will to a certain extent, you know, if they're adamant about the step therapy, but there's patients with needle phobia that literally physically cannot bring themselves to self-inject. Some insurance companies will recognize needle phobia as a diagnosis. It is a diagnosis, but a lot of them are like, mermaid hair, don't care.
Figure it out.
So I think actually Dr.
think that's a
Bach
good
might
idea.
have a good idea, because on the self-funded insurance card is the patient's company logo. So I had asked him, I said, how long does it take for a patient to trust this office? And Dr. Bach looked at me and he said, about 20 minutes. And I said, really? He goes, yeah, most of the new patients that I see have been dismissed and ignored, and their symptoms have been, say, you have fibromyalgia, or, you know, they don't know what to do with them. And if you're a hospital employed primary care, they want you to keep the patient in the system. And the big money makers for hospitals are bouncing patients between surgeries and pain management for inflammatory conditions. And guess what? If you have an inflammatory condition and you get a back surgery,
Doesn't
you
help.
still have the inflammatory condition. So you still have the symptoms, except now you've got 36 stitches in your spine, and there's a real good
little
chance
less
that
movement in your vertebrae.
and you're worse. So
I think that's brilliant.
that's Dr. Bach. That was his idea.
Oh,
So I
smart.
said, oh, perfect. I'll talk to Claudia about it. She doesn't have anything to do. There's another project.
Or LinkedIn. You know I love using that.
Yeah, so anyway, that's just kind of my morning musing. Is that even a thing?
Yeah, now it is.
Okay, so also, I wanted to share something about
Hi, Jack.
that we tweeted out. Good morning, Jack. That we tweeted out about some super big nonsense from CVS. Okay, so CVS, this like really makes me hot, and they wasted about 26 minutes of Dr. Bach's time. I'm fine to have my time wasted because I can do lots of things while someone else is wasting my time. Dr. Bach can't. He has they pulled him out of patient care to jack around with CVS. Anyway, the medical director over at CVS, the rheumatology medical director, schooled him or attempted to school him on how it's no big deal to make non-medical switches. After further review, is this on like the turnaround
Yeah,
thing
you
or
can
not?
see it.
Okay, so this is what I tweeted out. I don't know, you know, I don't know how to work things. Oh, for God's sake, look what I just did.
This is not a promotion.
No. God, I hate CVS.
Just
Okay.
click the picture.
Click the picture. No, I wanted to see what time I tweeted out. It doesn't
Oh.
matter. It must have been 8:13 p.m. Okay. But I didn't even know about this, okay? And I don't think they told us about this.
They
CVS or their stupid rep, who is a complete
Jerk. She dropped off.
it's a him.
Oh, Cloudy?
Shh. You can't say that.
Claudia.
Yeah,
That's
Claudia.
what they called me in France.
Okay, can we not bring this
I
back
was
here?
trying to save
International. Okay, so the CVS is paying patients. God damn it! Why can't I do anything? Okay, they're paying patients $200 to soften the blow on non-medical switches from branded Humira to. Are you ready for this? Someone might need to get a piece of paper out. A biosimilar that CVS and Aetna manufacture and own. So just when you think they can't make any more money, they can. This is like their revenue streams have revenue streams.
Well, and that
Okay.
goes to show what Dr. Bach had said too about it being a financial motive, because obviously it is. Otherwise, they wouldn't be able to offer a $200 gift card.
To every patient, okay, I don't know. Maybe it's my headband that's making my glasses look crazy. All right, anyway. The Hyrimoz, that's the CVS owned and manufactured biosimilar. Who needs a patient transition program? How about you just let the stable patients stay on the drug? Provides a one-time reimbursement of costs to the patients who transition from Humira to Hyrimoz of $200. Like, how is this legal? How can you pay patients to say, you know what, non-medical switch, no problem.
Biosimilar? It's close enough.
It's close enough. So I tweeted out, of course, CVS doesn't respond to me. Nice move by CVS Pharmacy to help patients with the trauma of a non-medical switch off Humira to CVS-owned Hyrimoz. CVS will pay patients $200. What? Question mark? You know I love a question mark. Use the $200 towards a coffin? Question mark? What? I'm so funny and cute, right? What are you doing with your hee-haw laugh?
Oh, use it towards a coffin?
That's what I tweeted. You need to follow me
I
closer.
do follow you.
Okay, well, you missed all this.
So they can require you to take the medication they manufacture, use theirs, or deny.
That's 100% what it is. Yes. So, anyway, we have 78 patients that are involved in this. Of course, they don't think that's a big number. But this is 78 lives you're jacking with. And we posted the Dr. Bach audio and video of him talking to the chief medical denier officer. And she doesn't work with patients. And she's like, well, not at this time. And we're like, you're paid by Caremark, CVS. She's like, that is correct. And this is no big deal. And she goes, you're going to be laughing about this in 10 years. I'm like, we're not laughing
Dr. Bach's
now.
like, I'm scared for what we're going to see in the future because
Right.
of this.
Right. So anyway, that is just a little shout out to Dr. Cassidy, Chief Rheumatology Medical Director, CVS Caremark.
These are the people that are going to be taking over your care once all the doctors quit.
Yep.
So excited.
So, and you know, in a day and age where we have a rheumatologist shortage, to take someone fresh out of fellowship, she graduated from Fellowship of Rheumatology in
Jen said,
2019.
oh, well, you and Dr. Bach schooled her.
Well, we tried to. I mean, I don't think she saw it like that. But, I mean, here's the other crappy thing. To take a rheumatologist out of patient care and into denial and delays for a PBM, like, how did they get her to sell her soul so quickly?
She probably wasn't able to get certified.
Well,
get
that's
credentialed.
not...
Kind of like that one doctor.
I don't know. Oh, you mean Conway?
No, the one we had that...
Oh, well, I don't know.
You remember?
Not really, but I don't think that there's anything. Who knows?
If you
Who
can't
frickin'
prove
knows?
you have the patient's safety at best.
It's
Illinois is going after PBMs.
well, I hope so. I think no one does it better than Ohio because they've got an attorney general that is a bitch on. Well, it's not a woman. It's a man, and he's amazing. And he's like,
That's a compliment.
yes. I love an AG that shows up and does the right
Ours
thing by
doesn't.
patient. Well, ours can't because Express Scripts is headquartered here and they own all the legislators here, so we can't have nice things in
But
Missouri.
we'll be outside there 17th.
We will be outside the Express Scripts headquarters, and we will be coming live multiple times and bringing 4 staff members. So, yeah.
Not my 4 personalities, just there will
Not
be
her
4
4
of us.
personalities, just 4 total people. But we're going to have, I think 300 people there. So
300 to 700.
I think I liked the smaller number because then we can be really excited if we get more than 300. Keep your
I'm like-
expectations lower.
I always do have high expectations.
Okay.
We got to turn around on one of your patients.
We got an override on one of my patients, and it was really a mess because I kept trying to deal with Optum, and I had, when I tell you that I chart, somebody blows a fart on the phone, I am charting that. Optum RX agent Cree, Kree, told me that we had no chance of a peer-to-peer, and she literally went out of her way to not be helpful. And so after I got blown off, the very, very, very worst thing you can do to me is to ignore me, okay? Because it makes me mad, and then I ratchet up. I escalate. So I was talking to my friend, and he's like, hey, why don't you email Dr. Patrick Conway at Optum. He's an MD. He's the chief medical officer at Optum. And he's like, hey, there's this little article on him if you want to start there. So I read the article. He used to be the chief muckety-muck medical officer at Blue Cross Blue Shield of North Carolina. Accidentally got a DWI. Accidentally had some sort of, porn situation. So they fired him. But guess what? Incestuous Optum scooped him right up, put him
You'd
in the
be great.
top job. They're gonna love you. So anyway, I emailed him, and some minion that apparently looks at his email emailed me saying, hey, you know, we really want to talk about this situation. I'm like, oh, I got all day to talk about it. What I need you to do is override it and let this patient get treated. And
Optum likes the bottom feeders.
oh, do they ever. So, but I got an email from United Health Group executive office saying, Dear Julie Bach. They don't even address it to Dr. Bach now. That's like, whatever. Thank you for, oh, you know what? I should just read it. Where is it? Where is it?
I should just read
I'm going to just read it. I had it put it in the patient chart, but like this is kind of like
Super Bowl.
It is a Super Bowl. Do you think I already filed it away?
If I know you, probably.
Yeah, I probably did. Hold on a second. I got an electronic filing system that is deep. All right, hold on. United Health Cartel. Where is it in my files? I'm sorry to waste everybody's time looking for this. Okay, here we go. All right, let's see. Here we go. All right, so, I am writing today to confirm receipt of your email correspondence you recently sent. Thank you for bringing this important issue to our attention. I have forwarded your concerns to our clinical team for review. I will reach out to you on May 8th with a status update. What is today's date? May 9th. You know what? For once, they did what they said they were going to do. Isn't that weird? Okay, so this came from United Health Group, UHG, Consumer Affairs, okay? And, now where is the damn thing? Hold on. UHG, okay. The lady who's been helping me over there, her name is Ishtar, Ishtor. She actually called me. Let me search on her name. Ishtar.
Teddy Altman?
Teddy Altman, who's that?
I don't know.
Oh, no, not Teddy Altman. Okay, all right, here it is. Here it is. I apologize for having the delay here. Dear Julie Bach, we received your email dated May 6, 2024, sent to Optum Consumer Affairs. I didn't send an email to Optum Consumer Affairs. I sent it to frickin' Patrick Conway. Doctor. Okay? Thank you for contacting us and letting us know about your concerns. We take them very seriously. Really? Because it doesn't seem like you do.
Seriously as the hack?
Yeah, about as seriously as nothing. Our clinical team has reviewed the medical documentation you submitted for, this is the patient's name, and have overturned their original decision. The authorization has been approved for Cosentyx IV beginning April 8th, okay, and it's gone for a year. But here's the stuff, all right? I've been working on this case since April 8th. It is now May 9th. It took these people 30 days of BS and me getting out of my seat and getting loud with all sorts of people. So,
and then emailing that doctor's email.
Right. And I said to my team, I forwarded them the email saying, please get this patient scheduled ASAP. New start Cosentyx IV. UHC has overturned the denial. Imagine that. Boom. Got another one.
Sounds like they got legal involved and were told to do the right thing.
Well, I don't know.
Probably. PILS photo.
Oh, you want a photo?
Oh, please, photo.
Okay, well, we got to redact the patient name and my contact at United Healthcare Group, UHG. Can you do that?
That's so true. They probably were like, he was like, what do we do? How do we get them?
I mean, I have it on my recorded calls and on my chart notes of this Optum agent completely giving me crap information, trying to tell me she was setting up a peer-to-peer with Dr. Bach and another United Healthcare medical director. And I'm like, perfect. What's that doctor's name? She goes, I don't know how to pronounce it. I'm like, spell it. As she's doing that, I'm putting it in Google. I'm like, and this is a physician, an MD, a medical doctor. And she goes, oh yeah, this is a medical doctor. I'm like, false. Here's her NPI number. She's a nurse practitioner. Liar, liar, pants on fire. And then Cree, the agent at Optum, completely just blew me off. Never got back in touch with me.
Did you get hung up on?
You know what?
You were on the... Was that a different
I'm always
patient?
getting
You were on
hung
the
up
phone
on.
and you're like,
It's
Victoria?
That was
Victoria.
that was a Medicare Disadvantage patient yesterday. It's very convenient for insurance companies to have a bad connection when you have goats in the background and these customer service agents or whatever they're called, specialists, are in India with, trying to feed chickens while they're on the phone with me. So, that happens. But at any rate, we'll redact that and put that up.
All right. Well, that's our morning catch up.
Yeah, a morning catch up.
It's a good thing.
Thoughts
on Taltz and Medicare. Humira is always Express Scripts go-to.
Well, Humira is the Express Scripts. It's usually a PBM go-to because it's the most expensive. I mean, understand that Humira annual drug spend is around $100,000, and a Symphony Aria, which would be a better patient experience with only doing it 6 times a year versus doing it, every other week with Humira. And if you get an infusion, we deal with the administrative burdens with Optum or whoever your PBM is. But if you don't, the patient has to deal with it. So they make you spend more money. I mean, J1602 Symphony Aria, I mean, it's a weight-based drug, but that drug spend is like $30,000 a year. But what do the insurance companies and the PBMs want you to go to? All these sub-Qs first. There's a rule for every drug in this office, but the administrative burdens are put on the patient every time you deal with the pharmacy benefit manager. I actually recently had a patient, Melissa, that was on Stelara. We had to take her off. She was on Renflexis. Her GI said, I think she should be on Stelara. We put her on Stelara. Express Scripts and Accredo is like such a fail. It's dosed every 8 weeks. And we had to give her physician samples for 6 months.
Yeah.
Because Accredo can't get it together.
And then we finally got it through. And Dr. Beck's like, this is an access issue. Get her back on infusion therapy. The hell with Express Scripts. They don't care. And Accredo is just like, blah, we don't know what to do. They really thought messing with Julie was a good idea, ? You would think they'd learn by now.
Who? Oh, United Health.
All of them. I mean, Julie Buck has to be a name. Like, your picture is probably on the back of the CEO's doors with a dartboard.
I mean, I'm fine with the dartboard. I am just an old sea salt here, and I'm throwing down for patients. I've always been throwing down for patients, but the more they ignore me, the more they tell me no, the more I'm like,
you don't tell Julie.
Yes.
No one tells baby no.
I don't throw down on cases that I'm not 100% right on. But
or if the patient won't stand shoulder and shoulder.
Right. If the patient doesn't care and they don't mind doing what their insurance company wants them to do, I mean, we can either potentially help them, or they can go to a doctor that doesn't mind having their license jacked with. So we're just
Julie is a patient first, and then companies don't speak that language, and those companies don't speak that language.
Yeah.
My doctor gave me samples of Actemra for almost a year before insurance finally approved it.
Yep. I mean, this is an access issue, and people are paying premiums, and they're paying huge amounts of premiums. They're getting saddled with more and more patient responsibility, and then their insurance company is just like smoking cigarettes.
$3,000 a month. For your medication.
They're
Sorry,
we
forgot to tell you before sending it, but that's a bill.
And everything is like, this healthcare's too complex. It's not complex. It's not freaking hard. The people making most of the money, the PBMs and the insurance companies, and doing none of the actual healthcare work.
Even manufacturing companies are reaching out to us like, we love what you're doing. Thank you so much for educating the patients. Like, people think it's PharmD, which I guess that's part of insurance.
Pharma. Not PharmD. PharmD is a pharmacist. Pharma is like your Novartis,
Everyone
J&J.
thinks it's big pharma, but they want you to use their drugs. That's why they have it. That's how they make money. But when these specialty pharmacies come in and take off all of it and use copay assistance to pay for it.
Listen, pharma is not without faults. Their faults in the world
are playing into the game.
Their faults in the world, according to Julie Bach on this satire little show here, are that they have been paying to play. They pay billions of dollars to the PBMs to get on the list. If they stop doing that, shit changes really quickly.
And that's
they're
where
too
we come in with our
afraid.
drug plan.
They're too afraid to do that, but we are getting there. We are getting there because these employers are fed up, and we're going to walk self-funded employers into a lane of saying, do you want your employees to have
appropriate, happy employees,
appropriate health care, or do you want one size fits all according to the world
turnover
of PBMs?
Have a great day, ladies. I have to get busy. We appreciate you.
We do too.
Yes. We meant to get off like 10 minutes.
I know. All right. Bye, everybody.
Bye.